Teri. I'm in section 7. I'm going to begin the NG tube insertion. First thing I'm going to do is verify my doctor's orders. I'm going to check for this size, type, and place purpose. This is going to be a 14 French NG tube. The purpose is for low intermittent suction, and it can also be used for tube feeding. I'm going to perform hand hygiene, and I'm going to don my gloves. And the first thing I'm going to do is verify my client's name and date of birth. I'm going to assess the NARS. I'm going to ask my client to check to see if there's any issue with breathing. I'm going to check for a deviated septum, any nasal surgery, or any bleeding or swelling. I'm also going to check the posterior pharynx for any problems breathing and any other inability to cooperate. I'm going to have my client positioned in a high Fowler's position. I'm going to measure my tube from the tip of the nose to the top of the ear, down to the xiphoid process, and that's going to be my marker. I'm going to lubricate my tube 4 inches. I'm going to insert my tube in a downward motion towards the tip of the ear. I'm going to ask my client to lean his head back and tell him that the procedure is about to begin. So I'm going to insert my tube downwards. And when I'm inserting my tube, I want to check the back of the posterior pharynx and make sure that there's no coiled tubing. And I'm going to continue to insert, and I'm going to have my client put his chin to his chest and swallow with or without water until I reach my marker. And once I reach my marker, I'm going to tape my client's tube to their chin, and we're going to verify placement. So the first thing we're going to do to verify placement is we're going to ask the client to speak, and we're going to check the back of the posterior pharynx. I'm also going to order a chest x-ray if it's hospital policy, and then I'm going to measure the lab value of the pH for the gastric contents. So I would aspirate gastric contents. I would measure on a little pH strip, and then when I reintroduce the contents, I'm going to listen for a swishing sound. Over the epigastric area. And reintroducing the gastric contents. So I hear a swishing sound. And my tube is now patent, so I'm going to anchor my tube. Over. And on the bridge of the nose. And now I'm going to place my rubber band. And allow them enough tubing so it doesn't interfere with their ADLs. And I'm going to apply my safety pin and attach it to their gown. And I'm also going to attach my tubing to low intermittent suction as the doctor ordered. And I'm going to lower my client's head of the bed to 30 degrees. I'm going to provide oral care every 2 to 3 hours. For irrigation of my NG tube, I'm going to come back in the room. I'm going to have gloves on. I'm going to put a client towel on the chest. I'm going to disconnect my suction. And I'm going to draw up 30 ml of gastric contents. So I have 30 ml.
Making sure I get all the bubbles.
And then when I reintroduce, I'm going to listen to the left epigastric area for a swishing sound. And then I'm going to draw up 30 ml of normal saline or sterile water.
And then I will ask the patient for any allergies.
And I'm going to
Assess their knowledge of the
attach that
medication.
to my tube, inject it,
And then I'm going to go ahead and check the IV side.
and then I'm going to draw
for any
back.
redness, swelling, or leakage.
And then I'm going to note the color consistency, the amount that I instilled and the amount that I withdrew. And I'm going to discard that. I'm going to attach my suction.
There's no pain at the site.
I'm going to document any trouble irrigating the tube. I'm going to document the color, consistency, and amount that was returned and instilled, and if there was any difference in that volume. I'm going to document my patient response, any client teaching that I have had, the amount of gastric contents, and the input and output.